Hello, welcome. Good evening, good afternoon here in London. Just gonna wait 2 more minutes and then we can start. Yeah, I think we can start, Dr. Vandana.
Yeah. Hi, everyone. Good evening. Can you hear me? Yeah, okay. Good evening, everyone, and those who are from outside of India. Good afternoon, good morning, depending upon your time. So, I would like to welcome all of you on behalf of entire SS Agrawal Institute of Physiotherapy and Medical Care Education. I welcome Ms. Joana and Mr. Thio Acosta from Pilates Institute International for joining us over here on this online platform. I would like to thank Neurotherapeutics for their kind support during this entire preparation and not taking much time, but I would just like to introduce the speakers for today. That's Miss Joanna. She is a physiotherapist and she is a Pilates instructor. So she has been masters in the Basi Pilates and Fletcher Pilates from UK, and she is working as an instructor since 2012. Mr. Thio is the director of Pilates Institute International, and he is the founder since 2010. He's working with the Brazilian Pilates Institute, which is the biggest, the institute in the biggest institute in the Latin America, and he is one of the member of the Pilates Institute over there. So he's training people with Pilates since a long time, and I hope that you guys enjoy today's session. With this, I would like to welcome our principal, our HOD madam, and my dear colleagues who are all gem of physical therapists, we make a team of physical therapists over here, and I welcome all of you over here. So not taking much time, let's just quickly start with the session. I hope that this session would be nail biting for all of you. Okay, so let's get started. Over to you, Miss Joanna.
Okay, thank you very much, Dr. Vandana.
Thank you.
Hello, everyone. I hope you are all doing well. It's a pleasure to be here with you tonight. And I'm going to start talking a little bit about who we are. Okay, just bear with me a second. We are Pilates Institute International, and we have been in the market since 2010, educating physiotherapists, graduating then in Pilates technique. And we trained more than 5,000 professionals in Latin America, and now we are expanding worldwide. My name is Joana Favro. I am a Pilates instructor, personal trainer, and physiotherapist. I graduated in 2012 in Brazil, and after that, straight away after university, I went to know more about Pilates, and there was a time when I met Thio and the company Pilates International, Pilates Institute International, and I just fell in love because they showed me a different view of treating my clients, and then I understood it's not just finding an exercises, but it's much more than that. Pilates brought me this knowledge, and today I don't treat any client without using Pilates techniques. And I moved to London in 2015, when I started studying with Fletcher Pilates, and then after I studied with Basi, and I've been working with all the uh, physiotherapy injuries and techniques and everything, and always using the Pilates principle to treat. Today we are going to be talking about how to apply the Pilates technique to rehab our clients, how to apply the method to musculoskeletal rehabilitation, and how it can help us physiotherapists to develop a clever and positive treatment plan to help our clients. But before I talk more about Pilates, I want to start telling a little bit about Pilates history. And for that, I'm going to be showing you a video, an animated video that tells a little bit, summarize his history. Okay.
A history of Pilates. Joseph Pilates was a fitness guru and inventor born in 1883 near the northern German city of Dusseldorf. His father was a prize-winning gymnast of Greek ancestry. His mother was a naturopath who believed in stimulating the body to heal itself without drugs or surgery. His mother's healing philosophy and father's physical achievements were to greatly influence Pilates' ideas on therapeutic exercise. Pilates was a sickly child, suffering from asthma, rickets and rheumatic fever. To make matters worse, the bigger children at school taunted him by making fun of his name. He became determined to overcome his physical disadvantages and dedicated his life to improving his health and strength. He focused on breathing techniques to assist with his asthma, and by exercising outside in his shorts, was able to cure his rickets, which is caused by a vitamin D deficiency. By the age of 14, he was fit enough to pose for anatomical charts. He loved skiing and being outdoors. He studied bodybuilding, yoga, martial arts and gymnastics. You can recognize the influence of these activities in the Pilates technique. For example, the long stretch and up stretch on the reformer are drawn from downward facing dog and plank in yoga. He uses punching and side kick movements similar to martial arts, and some exercises on the chair are similar to gymnastic ring work. The natural movements of animals also inspired him, and this can be seen in exercises such as the cat stretch on the Cadillac. In 1912, Joseph Pilates moved to England and earned a living as a professional boxer, circus performer and self-defence trainer at Scotland Yard. During World War I, however, the British authorities interned him, along with other German citizens, in a British enemy citizens camp on the Isle of Man. The health conditions in these camps were poor, but Pilates insisted that everyone in his cell block participate in daily exercise routines, which he had devised to help maintain their physical and mental well-being. Some of the injured German soldiers were too weak to get out of bed. Not content to leave his comrades lying idle, Pilates took springs from the beds and attached them to the headboards and footboards of the iron bed frames, turning them into equipment that provided a type of resistance exercise for his bedridden patients. These mechanized beds were the forerunners of the spring-based exercise machines such as the Cadillac and the Reformer, for which the Pilates method is known today. Pilates legend has it that during the Great Flu epidemic of 1918, not a single soldier under his care died, remarkable considering the terrible living conditions of the internment camps. After the war, Joseph returned to Germany and collaborated with experts in dance and physical exercise, such as Rudolf Laban. In Hamburg, he trained police officers. He was also pressured to train members of the German army, but left his native Germany, disappointed with its political and social conditions, and immigrated to the United States. En route, he met his future wife, a young nurse named Clara. The couple founded a studio in New York City and taught and supervised their students well into the 1960s. His method, which he and Clara originally called contrology, encouraged the mind to control muscles. It focused attention on core postural muscles that help keep the body balanced and provide support for the spine. In particular, Pilates exercises teach awareness of breath and of alignment of the spine, and strengthen the deep torso and abdominal muscles. Pilates came to believe that modern lifestyle, bad posture, and inefficient breathing lay at the roots of poor health. Joseph Pilates' New York gym put him in close proximity to a number of dance studios, which led to his discovery by prominent members of the dance community, including George Balanchine and Martha Graham. The Pilates repertoire itself has many references to classical ballet and also the Graham technique. For example, the ballet stretches on the Cadillac and ladder barrel, the round back and straight back in the stomach massage series on the Reformer. Many dancers, actors and famous people in New York depended on Pilates for the strength and grace it developed, as well as for its rehabilitative effects. Joseph Pilates wrote 2 books, Your Health and Return to Life Through Contrology, and was also a prolific inventor. He passed away in 1967 at the age of 83 in New York. He had maintained a fit physique throughout his life, and photographs show that he was in remarkable physical condition in his older years. He's also said to have had a flamboyant personality. He smoked cigars, liked to party, and wore his exercise briefs wherever he wanted, even on the streets of New York. It's said that he was an intimidating, though deeply committed instructor. Although Joseph and Clara had no children, his legacy and exercise technique.
Okay, can everybody hear me? This was animated. Can everybody hear me? Yes? Okay. So this was an animated video showing you a little bit of Pilates history so you can understand. He was a sick child suffering from asthma, and then he was encouraged and incentivated by his parents to have this healthy lifestyle where he created his own method of exercises, and he cured his problems, his asthma problem, through the breathing technique, to the exercises. And then after that, he helped during the war. He was using springs from beds to help making resistance for the exercises. And he moved to England, to USA, where he was well known and recognized for his methods. Now, when we teach Pilates, we have to be talking about the Pilates principles. And this is what makes the difference about any other exercises we prescribe to our patients and clients. In the Pilates principles, we start talking about awareness. Awareness is the perception and the conscience you have about your own body. Is the awareness, and it includes proprioception training, proprioception rehabilitation, all these parts of rehab. Then we talk about balance. Balance is a balance about flexibility, balance of strength, and balance of both sides of the body. Because we as a physiotherapist, we know we have a lot of injuries caused because of imbalance on our structures, imbalance of muscles, of strength, flexibility, and the difference of both sides of our body. Then we talk about one of the most important principles, that's breath. The breathing is a movement, is the movement of our diaphragm, is a movement of our rib cage, is a movement of our lungs. And this movement facilitates all the other movements. We are going to talk more about each principle soon. Then we talk about concentration. Concentration is the mental focus to maintain the other principles when you use the movements, for example. Then centering. Centering is about bringing everything to the center, to the core, to connect every structure and everything to a midline. We talk about having a midline in the middle of our body that starts in the middle of our heads and finish in our cocks. And this midline is always being reaching upwards. And then you have to think about bringing everything to the center, to the core. Then we talk about control. It's about utilizing stability and precision to organize the movement around the midline. Flow is the movement with the spinal articulation. You let it flow with the movement flow with the spinal articulation and the breathing, the breath. And the precision, that's this specificity of placement of your joints, of your body, of the posture. In Pilates, we can work in mat, just with a mat, or we can have some equipment and apparatus to work the technique. We have reformer, Cadillac, chair, barrel. We can use elastic bands, Pilates balls, and arches. And when you have these machines, it's easy to find a better positioning, but it still can be very challenging depending which level you're going to work. The apparatus is always there to help, but the mat Pilates is very, very important. So your clients, they need to be aware of their own body to work in the mat Pilates. So everything bring you good results. Us from Pilates International Institute International, we subdivide the principles to make it easy for teaching and make it easy for you to understand. We talk about awareness and concentration when you apply the breathing technique. The breathing technique is you inhale through your nose and you allow the air coming into the lungs, expanding your ribcage to the sides. And you exhale through your mouth, letting the air coming on top of your tongue as you bring your belly button towards your spine and engage your core during the exhaling. Centering is when you, during the exhaling, you bring your belly button towards your core, towards the spine. And if you are laying down on the mat, you're going to imprint your back on the mat. I'm going to explain this better with a video. Now, if you want to know in practical how to apply the Pilates technique, you can put your hands on your rib cage, and when you inhale, you have to feel a pressure on your hands going sideways, not forward, but to the sides. And as you exhale, you feel this rib cage going away of your hands. So this is the movement we want in order to engage the correct deep muscles. It's important to point to you now that diaphragm, it's one of the core muscles, deep core muscles. So this is the importance of always connecting the breathing when you apply the Pilates technique to rehabilitation or for any exercise you need. I have a video here to show you in practical, and you're going to be able to now visualize how it works. So this breathing is the Pilates breathing technique. Inhale sideways, exhale, bring your cage in, and down to the mat. Good. Engage all your core muscles. Inhale sideways. Exhale, bring ribcage in and down. Bring your belly button towards your spine. Good. It's a good engagement. Inhale to expand your ribcage sideways. And relax your shoulders. Exhale, bring your ribcage in and down. Very good. Okay. Could you hear the sound of the video? Okay, great. So was it clear how like the Pilates technique work, like the Pilates breathing works? It's very important to always associate this movement of your rib cage, of the lungs, in the sidewise, and not using your chest and accessory muscles while you do the movement. When we talk about the control and precision, we are talking about the positioning of your body. All the alignment of your pelvis, your lower back. So you need to be considering a neutral pelvis and a neutral lower back. And it doesn't mean if your pelvis is neutral that your lower back is neutral, or vice versa. It doesn't mean if your lower back is neutral that your pelvis is neutral. You have to think about the thorax, the shoulder blades in position, the head and the cervical spine. And when you do exercises standing, lowering the weight on the right weight, putting the weight on your limbs, and try to find that straight line of your body for a good positioning. Now, I'm going to explain you how to find a neutral pelvis and neutral lower back. Pilates methods work in a safely way with neutral pelvis and lower back neutral. So therefore, you respect the natural curves of the spine without stressing the other structures that you must not stress. So you are able to isolate joints, you're able to isolate muscles when you put everything in place. It's necessary to maintain the physiological curves and neutral spine in order to not overload and therefore injure the spine joints. So if you have someone with some postural problems, we are going to try to work in neutralize that wrong curves of the spines, bring it to neutral. If you want to find a neutral pelvis and a neutral lower back, there is a technique. You lay down on your back and you're going to place these two fingers on your aces, and then you're going to bring them together and bring these two fingers together as well. So you're going to have a triangle. This triangle has to be parallel to the floor. Okay, this means your pelvis is neutral, but it doesn't mean that your lower back is neutral. You're gonna find that very difficult to teach and make your clients and patient to understand if you don't understand that. So you need to practice and find the neutral pelvis. So now if you are having this triangle here and you have a cup of tea here on top of this triangle, this cannot fall. Okay, so it needs to be parallel to the floor. It's a horizontal plane, and they have the aces and the pubis, they have to be in the same line. Okay, so these two fingers here goes to your aces and these two fingers goes to your pubis. Okay, and then you can try to imprint your lower back to the floor and then bring a little bit off the floor again to find a neutral lower back. And we are going to work the exercises on this position. Thorax positioning. So if you have a postural problem, like let's say a kyphosis, where it's like your thoracic spine is forward and you have that C curve, you really want to try to bring that to neutral. But sometimes if the problem is structural, it's difficult. You can't. You just have to try to make the muscles work to bring that spine, to force it to neutral. Okay. Shoulder blade and neck and head position. Your shoulder blade, we say you have to try to bring the shoulder blade and the scapulas to the pockets. So you bring this down and low. Okay, so you're not overusing these muscles, you're not stressing the shoulders. You put this down and away from your ears. Okay, now when you put this down, if you have a wrong position, wrong posture, you might gonna have your head here and your chin here. So it's important that you bring your chin in and you elongate your neck on this way, on going forward, going to the ceiling, to the top, upward. The flow also works with the alignment of your spine and the balance. Okay, again saying bringing everything to midline, close to the center, and find the balance of anterior and posterior muscle chain. So try to be aligned, find a good alignment. For flowing and mobilizing your spine, in flexion and extension, we can start, for example, with exercise bridge, okay, where you first tuck your tailbone and lift your spine up. So you have to think about moving this spine very slow, vertebra per vertebra, and let it flow slowly. You're not going to move like a block. You need to flow slowly. Also, the cat position, where you are going to arch your thoracic spine and bring it to neutral and opposite direction. And so these are the two movements in flexion extension, and is when you have to think about flow. And when you think about this is the movement of flexion extension. Now thinking about rotation of the vertebra joints, a good exercise would be, for the spine mobility, would be a spine to spine, when you lay down your back and bring your legs to tabletop, and you just bring your legs to sides, to the other side. You're doing this movement to your spine, the rotation. Okay. Also moving the upper body, just lay down on your side and then bring your legs to tabletop, 90 degrees on your knees, 90 degrees on your hips, and you just move your upper thoracic, opening and stretching the pecs muscle and allowing the upper back to rotate. Okay, now we talk a little bit about all the principles and how you have to use that when you apply the Pilates technique. And now we are going to be showing you some case studies about how I treated my clients and patients and different disorders. And we are going to start with hypermobility disorder. So in this video, my client is going to tell you how she was having regular physio sessions before and she was afraid it was not helping. And when she started having the Pilates with me, that I'm a physio as well, she just find the best solution for her treatment. Please let me know if you can hear and see everything clear.
I have come off the back of years of physio. I was diagnosed with hypermobility spectrum disorder and Ehlers-Danlos syndrome 10 years ago, and I did develop a phobia of doing physio exercises on my own, because I would cause a flare-up from doing my exercises without them being monitored. Since I've had Joana and had the regular input from her, I have a better understanding of my body and have a better understanding of what I can do on my own and what I should do with the help of a physio. The added knowledge of Pilates has helped, and now I'm happy to do exercises on my own. When I first started with Joana, I found it so hard and so painful to do the stretches, just basic stretches and exercises, that I really did want to give up. The improvements are really there, and it's not my imagination. My core strength is up, my enthusiasm is better, I feel better. When I have a flare-up or something goes wrong now, I am surprised by it because it's now unusual as opposed to the norm, and it's all down to sticking with the lessons.
Okay, so Emma is so happy now. She found what was the best for her through Pilates. It was not just a matter of some exercises, some rehab rehab from physio. She needed something more, and through Pilates she found like a lifestyle. Now she came first to me with afraid. She came with a lot of pain, and she was like suffering so much. She didn't know what to do anymore. She was under medication for pain all the time, and now she managed not to having medication anymore. She's happy and so grateful. And before she came for treatment, and now after all this time, like more than 2 years we are together, and she's still with me practicing Pilates. Of course, we always focus on her problems, the technique to her, like is a bespoke program that we choose for her. But she's so happy now. She needed something more than just an exercise. And one of the exercise Em and I do together, it's, for example, spine twist supine. Okay, this exercise, it's not, it seems easy when you look, but it's not easy. When you put everything in place, it's difficult to control the core, to control your shoulder blades on the floor, to not stress your shoulders, to keep your knees aligned. You really activate your deep core muscles when you do this, while you rotate the spine. So this was one exercise that we were doing together. And as I said, now Emma has this as a lifestyle, and she just she see me twice a week for exercises and keep treating. Now I'm gonna present to you a case study of post-surgery total hip replacement. So this client of mine, he is a physiotherapist. He is a senior physiotherapist, and he really, actually, he came to me before the surgery to prepare his core, to prepare his muscle for the surgery. So then after the surgery, he wouldn't lose it too much. So after the surgery, we just kept treating him and rehabbing his movements, his strength, and also working the posture.
Hi, my name's James. I'm a senior physiotherapist. I had a total hip replacement 1 year ago following trauma to the hip several years ago and developed osteoarthritis. The hip had become very painful, very stiff. I was limping heavily. The knee had become very weak. My overall physical condition through the right lower limb had degraded. 5 weeks post-surgery, I got down to one crutch. I began clinical Pilates with Joana to recover range of motion at the hip, to recover strength, re-engage my glutes, which had weakened considerably. Also the quads had lost a lot of strength. I needed to restore normal gait. So the Pilates helped engage the core, the glutes, improve my walking, improve proprioception. I needed to engage core again. It helped with the swelling. Associated movements in the lumbar spine needed to be recovered. It's quite wide-reaching, the effects of an arthritic hip throughout the body. I was even getting sort of shoulder stiffness and pain, so a global approach was really important. So we addressed my posture as well as my normal function in the hip and gait. Without Joana's help, things would have really been slowed down, but I found after every session, walking was improving, my function was improving, the activities of daily living were improving. It's can't be stressed enough. Early intervention, early rehab. Rehab is really the treatment straight after surgery. The swelling will kind of take care of itself so long as there is good rehab, good exercise therapy. A little later on we dealt with scar tissue and adhesions. But the primary goal was to restore normal movement, and the Pilates was key in this.
Okay, some people are saying that the video was not audible. Did anyone could hear it? Clearly, okay. So please make sure you check if all the settings are right, if you have the mic, like the sounds working good. Okay, good. All right. So James, he's a senior physiotherapist, and he's so clever, and he works. It's been so many years in London with physiotherapy, and he saw a lot of different things. Why would he come to treat himself with Pilates? He's not he didn't study any Pilates, but why? He understands how Pilates see a problem, not just like in one single joint, in one single thing, one single muscle. It sees your body in a whole. It works in everything. We all of us know that when we have an injury, it doesn't come by itself. Always have other injuries as well. So if he would, like, after the surgery, suffer from his hip, also all his sides of the surgery would be affected because of not loading on that side properly, and the other side would be overloading, so you would have different problems in different parts of the body. So Pilates sees that as a whole, treats everything, starting from the core, from the concentration, from the breathing, being there, focusing in the movement, focusing in the exercises. Bear with me 1 second. So one of the most famous exercises in Pilates is the pelvic curl, is the bridge, where we were working in close chain to make that glutes stronger again, make that mobility on the spine, elongate the quadriceps, think about shoulder blade stabilization. And this was so good for him. And we start with the simple bridge, and it's very difficult after surgery. And we just progressed for so many other exercises. But you can make, just in the bridge exercises, you can change this. You can make this on a roller, on a ball, on the heels, on the toes, with single leg. You can make so many different variations in one exercise. And for him was very important. After progressing, we were in a bozu where he had to work the proprioception, and it was fundamental to work back his movement and his rehab. Now I'm going to be showing you a case study about plantar fasciitis. So this client of mine, he had agony pain on his feet, on the fascia, on the heels as well. And he tried rehabilitation for such a long time. And then when he came to me, we start with the principles, we start with seeing his body in a whole, not just the problem on the heel, on the fascia, on the feet. We were seeing the weakness of the core, the weakness of the gluteus. We were looking to the wrong posture. And then he just keep nowadays just practicing Pilates
to start with,
as a lifestyle.
So to start with, I was having knee pain, and about 15 years ago I had 2 knee operations, which helped a bit with the knee pain, but I then developed pain in my feet, which got progressively worse over a number of years, and it deteriorated to the stage where eventually I was finding it painful to be on my feet or to walk for even 20 minutes. Then I saw a podiatrist and I got some orthotics, hoping that would help. It didn't make any difference at all. And then I started with the Pilates, regular Pilates sessions under Joana's instructions. And since then I've been doing the exercises that she's been giving me on a regular basis, and I've experienced a significant reduction in the amount of pain that I experience with my feet. I can stay on my feet for a lot longer. We've been doing a lot of lower body strengthening work. We've also been doing a lot of core work and upper body, because incidental to all of this, Joana identified that my posture wasn't good, and that was maybe feeding into the problem that I was having. Well, what I've noticed is that overall general health, strength, flexibility, mobility all have improved. And so although the starting point for me was the pain in my feet, what we've been focusing on is the placement of my entire body and how that affects how I use my legs and how I use my feet, with the hope that if I keep my head in the correct position, if I keep my shoulder blades in the correct position, if I engage my core, if I'm recruiting my leg muscles in the right manner, then that is all going to help to prevent pain in my feet.
Yeah, so Paul just keep with Pilates now, just as a health lifestyle because he feels so good, because works everything on his body. And I repeat, and I want to reinforce to you, Pilates is just gonna bring you so much benefits, and it's gonna improve your physio skills, because it's gonna make you look to your patient in a different way. You're going to look to everything, not just a single injury by itself. And one of the exercises, just to show you an example of exercises we are doing together, it's, just bear with me a second to open here. One of the exercises we were doing, it was on the reformer, working with hip series, leg work, core work. In Pilates, you're going to be always be working your core in every exercises. There is no exercises that you don't engage and you don't think about your core. So this is what example of exercises we were doing with Paul. Exhale. You can go down first. Down, 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 down. Here, external rotate, open. Exhale and come. Well done, very good. This was a briefly example of one of the exercises I was giving to Paul. Okay, so when you think about applying the Pilates technique on your rehabilitation session, as any other exercises, you have to think about warming up, development of the session, and an end of the session. It's much more fun when you work in a session like a lot of different exercises and focusing a lot of things, and you don't just go there doing reps of the same exercises. So Pilates is so good because it works different things in the same session, and the main goal is to work the body balance, as I said, balance of the both sides, back and front muscles, balance of ligaments, tendons, proprioception, balance of strength and flexibility. And even though you're going to be using the method to rehab your clients, you, as I said before, the injuries, they don't come isolated. They don't come by itself. You can have a chain of other problems coming together with the injury. We work the whole body, emphasizing the problem. So it doesn't mean that you're gonna rehab one problem, that you cannot think about everything. You can think about everything while you are rehabbing one injury. And you just can focus on that problem while you're working everything. So as I said to you, the session has the warm-up, the development, and the stretching part. The warm-up is teach the movement to your patient, to your client, teach the principles. And you can use how to do teaching them how to use the proper movement to development part of the session as a warm-up. So just practicing how to do the movement before you really do the movement. So let's say in leg changes, where you bring your legs to tabletop and you're gonna lower one leg and the other, before you do that, just do with one. So you're warming this hip, warming the joint, warming the muscles, warming the core. Okay. Also, it's important here to add mobility exercises for each movement of the spine, would be rotation, flexion, extension, and side bend. And dynamic stretches are also part of the beginning of the session, the warm-up. Development is when you really focus in strength and core and lower and upper limbs. And then here you can make the challenge, make exercises to challenge resistance, balance, and coordination. End of the session is stretching to really focus in cooling down and making that muscle that work during the session just relax and stretch. Now I'm going to be showing you a video session treatment for treating kyphosis, hyperkyphosis. So these clients, you can see the before and after, right? Before it was very accentuated kyphosis. The chin was forward, the neck was compressing behind. And after the sessions, he was so much better. The posture was improving, the core strength improving, and we worked a little bit on the floor, a little bit on reformer. I'm going to be showing you the session. So just wrap of each exercise just to make you more or less understand how we work. We start with pelvic curl to mobilize, to warm up, really making him to think about relaxing his shoulder blade and tucking the chin, focusing, doing a good articulation of the spine. When to spine twist supine, bringing legs to tabletop, connect inner thighs. And while you work this, you really have to think about not stressing this part. This is challenging because when you see, you're just lifting this. So you need to think about stabilizing your back muscles, bring your scapulas to the pockets, we say, like bringing this down and away, the shoulders away from your ears. Now that you're working and the rotation of the spine, but who brings the core back, the legs back, is the core. Core is the main one here working. Now we have the chest lift to work a little bit the rotation of the thoracic spine because it was so stiff, the fascia, the muscles, everything so stiff. And doing that, like lifting, doing the chest lift and adding the rotation, we were really working his core and the placement of the shoulder blade and mobilizing the spine. This is just warm up. But it doesn't mean that's warm up, that's not difficult, that's like too easy. To keep everything in place is the challenge, is difficult. Then we did leg changes, where again he had to focus and stabilize upper body and really not arching the back. So bringing that rib cage down to the mat, moving from the hip and keeping the knee at 90 degrees. It's a lot of things to think at the same time, but body gets used to educate itself. The more they do, the better they become. So leg changes with moving with legs together. Look, his chin was coming forward. I was always telling him to correct. Then he went to spine stretch, to loosen a little bit the hamstrings and to mobilize the spine again. Hip flexors here are working so much to keep this straight spine of his body. Now rotating, but still thinking about the alignment. See, he loses the alignment, and when I asked him to twist, he just loses. So I always tell, reach your midline up to the ceiling, reach it up, upper right, relax your shoulders, see how the mobility is affected to this side. Now the saw, you're gonna see a massive imbalance now when he does the saw. This side, it's okay, it's not perfect, but look to this side now. He just can't. The rotation is compromised. The shoulder is coming up. It's like it's not a good positioning. So we are trying to work on the positioning and to the alignment, to the flexibility. Every time I say to him, upright, find this straight spine and go forward, forward, and forward. Now this position, teaser prep, really to work his core and at the same time mobilizing the spine, because that thoracic spine was too stiff. So working in a way that the shoulder could not be in the middle of the work. Keeping this down and play on place. Now back support to open his chest while work his back. Look how the mobility on his shoulder blades not so good because of the tightness of the pecs. Now front support, keeping the spine neutral, keeping the core activated, head aligned to this thoracic spine. Arms supine seized on the reformer. Start with extension, really focus again, not overusing muscle that he should not be using. Just focusing in connect the inner thighs, place everything in place, and really focus in the core, breathing, then adduction. I am all the time telling him and guiding him of what I see that's coming wrong. Like if he loses his neck or shoulder of the position, I am there all the time saying, tuck your chin, reach out, relax the shoulder, keep your shoulder away from your ears. Upper circles, and before it was circle down. And triceps. We have so many exercises in Pilates, more than 600 exercises. We are not even counting the variations and the adaptations we could be doing for our clients. So it's a matter of you decide what's best to your patient, what they need the most, how do you want to treat, how you can gain more benefits in one single exercise. I chose to doing this exercise at shoulders level, just 90 degrees, just to make it a bit easy to him because he was losing balance. This exercise doesn't look like, but it's a lot about core. Core is what's holding you in place at this moment. Now the biceps. See, he's bringing his shoulder a little bit up, compensating, using other muscles, see? So I was always like, there and making him aware of the right posture, and then he was getting better and better and better. Now the triceps core is a lot about core. Core is stabilizing your body while he isolates the other muscles to do the movement. See, now he found the alignment. You can clearly see when he's doing right. And then we finalize the session with some static stretches that they are very important when in the end of the session to just work in the length of your muscles and to not just tidying up. Some good books for you to read. This one I really recommend. Pilates Return to Life through Contrology. Okay, and that's what I want to tell you for you today. Pilates is gonna just add more to your physio. It's just gonna improve more your skills even more, and it's gonna benefit and make you have more from the treatment. Thank you so much for being here with me today. And we just run out of time. If you have any question, I'm not going to be able to answer everything, but if you have any question. Hi, Dr. Vandana.
Hi, Joana. It was wonderful session.
Thank you.
By the time they type their questions, I would like my principal madam to take over for 2 minutes.
Yeah.
And then we can just go ahead with the question and answer session. Is it fine?
Yes. Perfect.
Yeah.
Yes. Okay.
Over to you, ma'am. Hetu, ma'am.
Okay.
Participants, you can write your questions in the chat box so that Joanna can answer your questions.
Hello, Dr. HV. We cannot hear you. I cannot hear you.
Just a second. I think, Joanna, you can take over the questions first and then we can give it to Hetu, ma'am.
Okay. All right.
Yeah.
Let's start with this one. Let me see what it is. How Pilates can fix uneven shoulders. So basically, you have first to do a good assessment and identify why your patient has uneven shoulders. Okay, so if it's a matter of functional scoliosis, where it's just like he is stronger on the right side, okay, and he collapsed to the right, and the left is a bit up because it's the weaker side, so the muscles cannot hold it down. So you have to just focus in strengthening all that side, and just doing the exercises and focusing the strength correctly in a good position. You are doing that. putting everything in place and connecting your core and really working the same way, both sides, not using the other one more than the one that you need the most, you are helping your clients. But first, it's important to identify why is the reason your client, your patient, has uneven shoulder. Is Utakash asked if is Pilates used for patients with cardiovascular issue? Yes, Pilates is one of the exercises that don't have anything. It's like swimming as well. Like everyone can practice Pilates, but you just need to be careful what are the limitations of your patient. Okay, Pilates for cardiovascular, it's so good because it's not a high intense exercise where you're gonna be accelerating your heart so much. Is you can in some exercises, but then you're gonna start slowly and you're gonna develop your session in a way that you can progress safely. So it's very good for cardiovascular issues, especially because you work in the breathing pattern as well. So it's all connected. Julie asked about breathing partner, which breathing partner we should follow during exercise and how. Okay, that's a good one. So the basic breathing partner, you are going to inhale to your nose, exhale to your mouth. And during the exercises, you inhale when you are still and you exhale when you move. So let's take, for instance, the breathing exercise. When you do the breathing exercise, the bridge exercise. When you inhale, when you're laying down on the floor still, and as you exhale through your mouth, you move your spine. You inhale when you are still on the top, and you exhale when you go down articulating. This is the best one when you have a first time patient and you want to teach all the other principles as well. Now, when the exercises are more challenging and they're a little bit quicker, and let's say leg changes with movements together, that exercise, you're going to do one movement when you inhale, the other movement as you exhale. Okay. And you also can do inhale when you exhale, when you go against resistance, and inhale when you go with the resistance. Is it clear? If Kavita asked if patient is unable to achieve ribcage neutral, then how should we proceed? That's a good one as well. So first, it's very important for you to be working the mobility of the spine, to try to lose it up, the fascia, to try to lose the muscle, because sometimes it's very tight, but it's tight because it's weak. So every time he needs to use that muscles, it tightens up. Gravity comes on this way. So it's always putting pressure on your posture. So always bringing you this way. So it's tight there, okay? You have to, if he cannot understand how to make this ribcage neutral, you have to start around teaching him how to mobilize that rib cage, making him and her aware of the mobility of that part, and then eventually it's gonna come. But also sometimes it's not possible to reach that rib cage neutral position in the thoracic because it's already installed a structural kyphosis, for example, instance. So you have to use some pieces of equipment to help with the position. Let's say if the kyphosis is too big, you need to use a block under the head to make him or her to be able to relax and stretch the pecs to try to make move more on their rib cage. We are about courses. Because of the pandemic, we are not doing anything presential at the moment, but we are going to start as soon as we can a course presential. We are organizing something for the last week of this month about postural Pilates applied to posture for you, but we are going to let you know by email. Hamstring tightness. So, is it tight because it's too strong? Is it tight or because it's weak? You need to identify that. What's the problem? But a good exercise to loosen it up is always in the morning, for example, you do a roll down, standing and articulating your spine down very slow to try to reach the floor. And with tiny move, we can hear you now.
Hi, ma'am.
Hi. I'm just finishing to
Fine,
give a
fine, ma'am. Carry
okay,
on.
thank you. And then you go in the morning like with some movements trying to reach the floor, and in the end of the day at night before the client's patient goes to bed, they go down slowly and they try to reach in a static way so they can gain more in flexibility. But it's important work in the two ways, dynamic and static, so you really gain more for that stretching. Again, if you these are three books that I recommend for you to read: Pilates Anatomy, The Evolution of Biomechanics, and the Pilates Return to Life through Contrology. They are very good books to read, and if you want more books, just email me or message me, and I'm gonna be happy to send you more options. Thank you so much. We ran out of time. If you really have more questions, just email me and I'm going to be happy to answer you. Dr. TV?
Yes, ma'am, I'm here.
Hi.
Hi, ma'am. So, we enjoyed a lot. So, all embodiments of love present over here. Very warm good evening from myself. I, Dr. Hetvijay Shukla, on behalf of whole Agrawal Education Foundation, would like to extend a very heartily vote of thanks to all of you. It's my pleasure to extend my gratitude towards two wonderful people over here. One of them, a very beautiful, having best brain, and along with her, Mr. Thio, and definitely Mr. Joana, ma'am, for gracing your important work and sharing with us your findings and opinions today in very short notice. It was great session. We all have enjoyed a lot. And by this session, our institute has achieved our first successful webinar as a new feather in our cap. It was really honored to have you, ma'am. And we are looking forward you in India, in our institute. Hope soon. I may like to express our sincere thanks to Mr. Shiv Idwani, sir, from Neurotherapeutics, who constantly be in touch with us and helping us for making this event successful. I would express my acknowledgement towards our ever supporting management of Agrawal Education Foundation, Mr. Mukesh Agrawal, Rajesh Agrawal, and Om Prakash Agrawal. Now it's turn to thank a person who worked really very hard to make us feel blessed by having such a nice speaker and coordinating very well with her precious time. Thank you so much, Dr. Vandana Patel. We are lucky to have you as our faculty.
Thank you,
I
ma'am.
really, yeah, thank you. And now it's time for thanking my lady army. Ma'am, we are running a college with ladies only. So I am having lady army, and they are always ready and always stand on their toes to make every event such a successful like this one. We are having rocking lady army like Dr. Ruchita Narsia, HOD of our department, and various departmental HOD like Dr. Khushali, Dr. Jagruti, everyone. And last but not the least, I am having a very wonderful audience. By them only, we are on the same platform, and the whole globe is like our friend. And we are looking forward to you with the various new topics, ma'am. And we are really thankful for everyone over here. And it's my immense pleasure to be in front of you and connected with you. Thank you, ma'am.
Thank you very much for this opportunity, and I hope I brought a bit of knowledge about Pilates for all of you. Thank you everybody. Thank you,
Thank you,
Shiv.
Joanna. It was
Thank
wonderful
you,
meeting to
Joanna.
you.
Thank you, and I hope to see you in the next one.
Yeah, sure.
Sure,
Okay,
ma'am.
thank you.
Bye
Bye.
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 Bye bye.